this Wellness Wednesday, we're diving into the possible health risks of taking supplements. This is coming amid the rise of the largely unregulated industry.
Yeah, earlier this morning on Today in AZ, Allison Rodriguez and Emma Jade sat down with a doctor to talk about some of the health risks.
The rise in the largely unregulated industry of supplements. Recent studies show supplement-related liver failure requiring patients to be waitlisted for transplants has increased eightfold, and that is really scary to hear.
I feel like I hear about a new supplement that's going to change my life every single day. And it's all coming from social media. So joining us this morning to kind of break some of those myths is Dr. Moises Neva. I want to start with what supplements should we be taking, especially women our age, which I know it seems like we're in our 20s.
It's rude.
It does.
Yeah,
but
I'm
like someone like us,
Yeah.
closing in on 40, what do we need to take?
So I think, first of all, thank you very much for having me.
Yeah,
Good
it's
morning.
a pleasure, yeah.
You know, the supplement, as you said, the supplement business is a $60 billion a year industry.
money, yeah.
And it's not fully regulated by the FDA.
And why is that?
Well, I think that all of these supplements don't fall under the category of medications per se, so they don't have all of the necessary studies ahead of time or upfront. And when there are complications, there are not the regulations that the FDA has set forth to report the complications is not as standardized for the regular medications.
See, I think that's fascinating because you're hearing how much it can impact people like that, and that it's not regulated?
No, it's not that regulated. And interestingly enough, if you look at some of the studies, when you look at the labeling of all of these supplements, up to around 50%, in some cases up to 80% of the labeling is not accurate. So whatever they're actually telling you that are on these supplements is not actually what they have there, or it's kind of compounded with other substances that may be harmful for the patient and whoever is taking it. So just to answer your question, what should you be taking? Multivitamins is okay.
So that's kind of the way that you
right.
should be going.
Yes, so multivitamins are okay, and obviously leading a healthy diet. So a lot of fruits, a lot of vegetables, exercise, just common sense. But whenever you get these supplements that are promising earth, wind, and fire, that they're going to change your life forever, you have to be careful, and you have to definitely consult with your primary care physician or your specialist if you have underlying conditions that could definitely impact whatever treatment you're receiving.
But it is interesting, though, because honestly, you could just get what you need by, what's simple, eating a healthy diet.
Right. Healthy diet is key. Exercise is key. And the other thing that is also kind of a little concerning is that all of these medications or supplements are, because they're unregulated, they're not going through the proper channels, if you want to call it, you can easily access them through the internet or through other...
Well,
so everybody has access to them. And if you're not well informed, you can actually end up getting hurt.
Well, so that was going to be my question. I mean, you can find them. You get them all over the ads, right, on your social media or late at night, or you're watching, and so you can just buy them. You know, I don't need to consult with anyone. I can just get these and start taking them. What are the risks, or what would you consider, you know, somebody to do if maybe they think a supplement, hey, I think that could really help me out? Should you buy it and then take it to your doctor, have them test? How do you even know what you're putting in?
That's an excellent point that you bring up, that because it's suspected that up to 60% of Americans are actually using herbal and dietary supplements, and they're not disclosing them, their use to their physicians. So what I would suggest in this situation is actually talking to your primary care physician, talking to your specialist, and explaining and telling them, okay, I saw this ad or this product on market online that I'm interested to use for X, Y, and Z case, and then say if that will interact or interfere with our treatment in any way, form, or fashion. So I would consult first before acting.
And what are the risks? If I'm just taking this supplement because someone told me on social media to take it, or if I'm grabbing this at the store because my girlfriend says that this gives her so much energy, what are the risks associated with that?
Excellent. So I'm a liver specialist. So looking at liver-related complications, the liver-related complications are things that can be as simple as just irritation of the liver, okay? But as you said, in small percentage of cases, then people can have significant amount of liver inflammation up to the point that you can develop liver failure.
Oh my God, yeah.
The easy way to kind of fix this is stop the supplement. Okay. If you stop the supplement, 9 times out of 10 things will get better on their own.
Oh,
interesting.
Okay, that's good. My goodness, but that's really scary to think that if you're taking that, you could really cause some major damage to one of your
it is
organs.
It's happening.
And it's
quite a
happening,
bit.
like we just talked about. Dr. Moises Neva, thank you so much for breaking this down for us. We appreciate it. And hopefully you got some good information from that on your Wellness Wednesday. Just to be careful with the supplements you see around on social media. Before you take them, consult. I like that.
Today in AZ expands into